Well, one would be we need to fund the FDA to really be able to expedite the approval process. The scientific discoveries that we've seen in the biotech field and even in pharmaceuticals has really become much more complex. And so there's no federal agency that could be expected to have all the resources internally. It needs to be more collaborative. It needs to look to outside experts, but it also needs to have funding to bring in some of those experts inside the FDA so that there's someone at the FDA that can communicate to someone in the industry who understands these breakthroughs in science, because that's a key barrier. I think another factor is we need to look at making the R&D tax credit permanent and increasing it in the United States. Other countries have done a lot more in tax credits to encourage innovation in their countries, and we have fallen behind there. And I would say probably third in that list, some might say it should be first, is to increase retention of foreign scientists that come to school here and keep them in the United States. So in other words, give them an expedited pathway to residency if they stay in the United States to conduct biomedical research, either for a company, for a university, for a research institute, and allow them to have a pathway eventually, if they choose to, towards citizenship. We can no longer be siloed into different groups, because the complex science that we've run into today, combined with the things that we didn't really know that we thought we knew, have made it more challenging. And so if we're going to be successful, we have to have groups collaborating, providing real-time feedback with each other. So you can't have the FDA sitting outside the process waiting to review the clinical trials at the end. They need to be involved in helping design the clinical trials and make them much more adaptive in nature. And patient groups need to be involved in this process. I've talked to a number of different cancer groups. If you talk to a cancer patient that's been diagnosed with 6 months to live, they will tell you that they will accept virtually any molecule in their body if it has any chance of working. So we need to have an agreed upon risk-reward trade-off. Rewards are not without risks, and we need to understand the risks involved, educate patients on the risks. But on the other hand, we need to have those incentives in place, and if the risks are too high for pharmaceutical companies in terms of their legal responsibilities, if there's a subsequent recall on the market, that reduces their incentive to invest in R&D.